In your previous video about avoiding a total hip replacement, I spoke about internal rotation, or at least keeping your legs parallel and trying to get into a full flexion, okay? So that's internal rotation, and flexion involves shifting your femoral head back. So that's a this in order to get that full flexion motion. Now, you still need hip extension, which means it needs to be able to slide forward, and a little bit of out-turn element comes with that, okay? So if you want to think about incorporating this into your life, let's talk about when you go to the gym to work out and resting positions at home, right? Because we always rest in sitting. Rarely do we rest in any position where our hips are not bent, right? So let's start with gym. When you go to the gym, if you do hip extension exercises, meaning do stuff with your glute, that's a bridge. Okay. Most times when patients come in and I ask them the bridge, they can lift about this high because they've lost the flexibility of going into this motion, but they've also lost activation of their glute. So instead of placing your feet far apart and thrusting with your low back, I only feel this part of my muscle. Try to practice with feet closer together, and I'm going to squeeze from my butt and get height by squeezing my butt cheeks together versus feeling it in my low back. That same premise carries over to a hip thrust. Instead of placing your feet far apart, have them hip width or feet together, and when you go, really squeeze your booty together and get height from your booty. Another great one is if you do an open chain exercise and you hold on, squeeze. But my squeeze, again, is coming from here. I'm not gonna swing up so my low back arches and I feel it in here. I'm gonna emphasize a controlled squeeze. The same holds true when you do the Roman chair where you hook your feet and you see people come up. Don't throw yourself up there and arch your back. When you come up, squeeze through your butt so you're getting a butt squeeze. And that way you save your low back, but you're using this muscle. Now, resting positions at home. As much as you can, it's great to hang out on your stomach because you're finally getting some hip extension and maybe even a little stretch into your hip flexors. Now, if you were like me, where my hip flexors were so overactive and tight, I couldn't lie on my stomach without feeling sharp pain. So, a couple remedies. Use a pillow fold. And you can hang out like that as much as you can. I would do press-ups, but when I would do press-ups, I wouldn't allow the hinge to be felt here. I would promote my ribs to get the extension and stretch forward from this level of my back. I wouldn't allow it from the low level of my back. Or you could do a quad stretch here. Your back should not be feeling it because the pillow will prevent the sheer force of extension from happening in your low back. So you could do that and hang out, watch TV, read a book. Now, for those of you who have hip flexor release homework, I would use this. You can use it parallel to your belly button if you're trying to get right side or left side, or lately I've been turning it horizontal just below my belly button, hanging out like that so I feel no low back pain when I hang out here. And then same thing. I would sit here in a quad stretch. That way I get to lengthen my hip flexors. I am in hip extension. And then I would work on getting some trunk extension where I feel it mostly at this level of my back, not through this level of my back. So those are two good ways to incorporate hip extension because it's not a functional position that we promote in our lives.